Thank you so much, Madam Chair, and thank you to all the witnesses for your contributions today. I'll start with Dr. Nguyen. Dr. Nguyen, you made the comment that we need to speed up diagnostic tests, get results to see, of course, if we actually need to prescribe the antibiotics in the first place. Who is responsible to actually make this happen? I mean, we all know hospitals have their own labs. We know that there are major chains out there, Life Labs, etc. But how should we make this happen, that we actually get results from diagnostic tests quicker?
So I will only speak to what I know about the Quebec system, because I believe that probably every single province has its own regulations and ways of doing. And so on one level, diagnostic tests are devices that do have to be approved at the federal level. However, the question subsequently becomes about approval on a formulary, uptake on a given hospital, and then implementation and availability. And so from a practical standpoint, I think that there are many barriers and many to this being a reality. And also, if we think about diagnostic tests in the human healthcare, there are many different types of tests that one can imagine, whether it is something that is available in a hospital setting to perhaps, what some of, has become more of a reality, which is more point of care, point of use, or even home testing. So there is a spectrum, and a number of those products at this time, I believe, probably do not have a track record yet of how to properly regulate and implement them. But there are certainly many local barriers as well as federal level regulatory steps.
So, as we're learning, things are really complicated. I would like to ask Dr. Weese, you kind of implied that perhaps there was a limited crossover between use of antibiotics in food, basically in the agricultural sector, and human health. Has anyone looked at quantifying how much impact the use of antimicrobials in animals has had in relation to resistance in humans?
It's very difficult. If we look at the global impact of antimicrobial resistance, whether that's globally or by high-income, low-income countries, if you look at the organisms that cause the most deaths, most of those you can't see a solid link with animals. Some of them you can. So there are certain organisms we know are being driven by antibiotic use in humans, human transmission. Something like Salmonella, E. coli, we associate with food and food animals. Those we definitely do play a role. But even within those, E. coli, for example, could be driven by human use or animal use. So it's very hard to tease that out. We do know, however, from a really nice Canadian example through CPAR, as was mentioned, that changes in antimicrobial use practices in food animals can influence resistance in people that are sick. So there definitely is a role. We just have no idea how much. My guess is it's low, and I think that's a reasonable one, but it's very hard to get a number.
But in essence, the less use, the better, presumably,
yes,
is when it's inappropriate. Canada has made some efforts to get new products through the regulatory pathway. I mean, there's been criticism, obviously, of red tape and difficulty in terms of getting new therapies to market. So there is an effort now by Health Canada to move toward greater international collaboration and reliance on foreign regulators, including FDA, etc. Any comments on this, perhaps, from Mr. Roy or Dr. Brockhoff? Is this going to help?
I would let Mr. Brockhoff go ahead.
It is a positive step forward. Is it going to be the entire solution? We're not sure. We have been exploring a lot of ideas across the different livestock sectors, the veterinary community, the nutritionist community. there has been a lot of barriers that have been built up traditionally. And so that white paper that we spoke about earlier covered a very broad gamut of what we think some of the barriers are. But there's going to be a cultural shift that has to happen as well. There is going to be a need to become attractive. How do we become attractive as a nation? And so reducing red tape, absolutely critical. Making Canada an attractive place to do business for investment in vaccination development, investment in medication development, investment in feed additives, water additives, all of these holistic things that can help us reduce the need for antimicrobials, critically important. But it's going to be more than just checking boxes.
Yeah, thank you.